Hello, I am Dr. Anil Kumar Singhi, Pediatric cardiologist working in Medica Super Specialty Hospital, Kolkata. As a doctor, we are trained to take care of the kids or patient in the best possible way. That is our training throughout our life. So quality is an absolute term and it is non-compromisable. If we need to do something, need to be done. As a doctor, we don't want to see that something substandard or not suitable for the timing for that patient just to make use for it, just to manage. That will not serve its purpose. At the end of the day, not only patient but my reputation is also at stake. the the society and the government has the responsibility to ensure the price or of something to be managed. As a doctor, for me, good things should be there. There may be some good things which can be used, but just for sake of reducing the price, using substandard thing is not permissible, and it in some way it is unethical because our oath do not allow us to use things substandard, not recommended, and thereby compromising patient's life. Life is precious, life is single. If some patient, he will ask to me, he has come with a great hope and expectation, the doctor please save me. He will never allow, if he is aware that something used which may jeopardize his survival, or there could have been another option which could have given him better care because he trusts me. He is not asking any question to me. So it's my responsibility to give back 100%, and there is no compromise, I believe. So to me, quality is best, and if we want to compromise that, there will be erosion in the care as well as the trust. And the trust deficit generated by these means is possibly one of the reason the doctor-patient relationship at strain, and people are no longer believing because they are coming to know, look, some substandard thing has been used, some substandard medicine has been given. The generic medicine which is possibly made in some corner of the city without all requisite tests, and that has not worked in the way it should have been. So quality is absolute. When we discuss in our personal life, we want organic desi ghee for some food, and that will have its own aroma. If we use all substandard adulterated ghee, and that will be not giving the same aroma, and it will be hazardous to the health. So I believe quality care is the right of the patient, and it's the responsibility of the doctors to provide quality care. Affordability is secondary to us, that either society and government need to decide how it need to be done. Congenital heart disease, there is a very interesting phenomenon. The incidence, this prevalence has remained same in last 100 years. It is 1%. So how it is changing in last 2 decade or 3 decade globally is better way of detection of the heart disease. More and more sophisticated means, by example, echocardiogram, or detecting even at mother's womb stage, you are coming to know the diseases which were earlier undiagnosed are getting diagnosed and are getting medical attention. So more detection is the reason we are seeing these diseases more and more often. People are also getting more awareness. Earlier the heart disease not detected, not diagnosed, not treated because it was not available and people were ignorant to it. Now people are also aware. It is not uncommon to see somebody having heart disease and getting treated without surgery by a device, getting home on day 3, and he is very comfortably sharing these facts, promoting another person to coming to medical attention. So society as a large, they are also more aware about the incidence, asking for care and getting care. So detection to care, this whole thing improved, resulting in significant change in the perception that we feel it is more in number, but actually it is more in detection and treatment. In last 2 decades, there is a significant revolution in the diagnosis and treatment of congenital heart disease. The new ways to diagnose the heart disease, starting from the fetal cardiology, like diagnosing in mother's womb, and then treating the heart disease because it is better diagnosed by modern gadgets. It can be treated not only by surgery, which was the traditional way to treat, now less invasive way, the disease can be tackled by transcatheter therapy, which is by devices putting stents inside the small baby's heart, and that is very cost effective and easy for the patients to have it. Medica last 4 years, we tried to establish a state-of-art pediatric and congenital heart disease wing. We are doing all sorts of structural cardiac intervention. We are using latest technology to deal with the heart's element without surgery, which earlier was not doable by surgery, without surgery. So we are closing even 1.7 kilo child underwent device closure of the birth related hole, and the bigger one, if I tell 73-year-old patient having big hole inside the heart, had a surgery without keyhole surgery done, absolutely day to discharge. So this is what changed in last 2 decades.